One special technique treatment we do in our clinic is called spinal manipulation. This is used to restore our spine. Normally our spine should be like blocks, they should be lined up properly. Imagine if it's crooked, then it's going to cause a lot of load. And if you imagine a building, if it's straight, then we don't need any force to keep it straight. If the building is tilting, then we need something to hold it. So therefore, most of the time, our upper back is crooked. So when we're crooked here, then it's going to cause a lot of muscle spasm. However, most of the time, the spine should be able to restore to normal. However, if it's stuck, then it cannot come back. The analogy is a door. A door should open and close. However, if the door is stuck in the frame, if you pull a little bit, the door doesn't open. So you have to do a very quick thrust to unjam the door. Same thing if our spine is stuck forward, we use a similar technique to restore. So most of the time we'll lie the patient down on their back and then we'll do a very small thrust. And most of the time we would treat the thoracic spine, which is the mid part of our spine, and it could help with locally in the thoracic area or also the neck and the lower back. And we'll demonstrate the technique. Here we will demonstrate a thoracic manipulation. I put my hand in the appropriate segment. We hold on to the arm, to the chest. We do a very gentle thrust, and it's done. 我们诊所做一个特别的治疗方法，叫做 spinal manipulation。那可以把它叫做为整椎。平常我们的脊椎应该是直立的，每一节是垂直的。如果这些脊椎它弯掉的时候呢，会造成我们的姿势不良。好像如果我们的身体往前倾的时候呢，那我们后面的肌肉就需要把我们拉回来，这样会造成后面的肌肉痛，还有其他可能会影响到你的神经跟其他的 function。那所以说，如果我们做一个比喻，如果一个门卡在门框的时候，如果你轻轻一拉它的时候，这个门是拉不开的。我们要快一点拉，把它拉开了之后，它就会动。同样，我们的脊椎如果它卡住的时候，我们做这个 spinal manipulation， 把它调回去之后，它就会保持是在垂直的状况之下。我们平常呢做这个 spinal manipulation 都是做在我们的胸椎的地方，因为我们大部分我们驼背做 computer 都是往这个方向。那把这个地方调回来之后，它会对你的胸椎、对你的颈椎、对你的腰椎帮助都会很大。我们待会儿给你看我们怎么做这个 treatment。这里我们来整一下我们的胸椎的两个地方。我们先用手找到需要整的地方之后呢，我们轻轻的按着，用一个很 gentle 的力量去推它，就是这样。